Question 1. What is the single most effective way to prevent the spread of infection? Choices are wearing gloves at all times, washing hands frequently with soap and water, using hand sanitizer only, avoiding contact with sick residents. The correct answer is B. Washing hands frequently with soap and water is the most effective method to eliminate pathogens and prevent the spread of infection. Question 2. When a CNA is helping a resident dress, how should they maintain the resident's privacy? Choices are keep the room door wide open, invite other staff members in to help, pull the privacy curtain and close the room door, dress the resident in the hallway. The correct answer is C. Pulling the privacy curtain and closing the door ensures the resident's dignity and legal right to privacy are respected during personal care. Question 3. Which artery is most commonly used to measure a resident's pulse rate? Choices are carotid artery, radial artery, brachial artery, femoral artery. The correct answer is B. The radial artery, located on the thumb side of the wrist, is the standard and most convenient site used to measure a resident's pulse. Question 4. When transferring a resident from a bed to a wheelchair, where should the wheelchair be placed? Choices are at the foot of the bed facing away, on the resident's stronger side, on the resident's weaker side, at least 5 feet away from the bed. The correct answer is B. Placing the wheelchair on the resident's stronger side allows them to bear weight on their stable leg and assists safely in the transfer. Question 5. In the acronym RACE, used for fire emergencies, what does the letter R stand for? Choices are run away, ring the alarm, rescue the resident, extinguish the fire. The correct answer is C. In the RACE protocol, the first step is to rescue any residents in immediate danger from the fire. Question 6. If a resident is choking and unable to speak or breathe, what action should the CNA take first? Choices are offer them a glass of water, perform abdominal thrusts, Heimlich maneuver, ask them to lie down, leave the room to find a nurse. The correct answer is B. Abdominal thrusts are the emergency standard to dislodge an obstruction from a conscious choking resident's airway. Question 7. To prevent aspiration while feeding a resident, in what position should the resident be placed? Choices are flat on their back, supine, on their left side, lateral, sitting upright at a 75 to 90 degree angle, high Fowler's, head lower than the feet, Trendelenburg. The correct answer is C. Sitting the resident upright in a high Fowler's position uses gravity to keep food and fluid out of the respiratory airway. Question 8. How often should a bedridden resident's position be changed to prevent pressure ulcers? Choices are at least every 2 hours, once every shift, only when the resident requests it, every 24 hours. The correct answer is A. Repositioning bedridden residents at least every 2 hours relieves prolonged pressure on bony prominences to prevent skin breakdown. Question 9. What is the best way to communicate with a resident who has hearing loss? Choices are shout as loudly as possible directly into their ear, face the resident directly and speak clearly at a moderate pace, avoid talking to them and write everything down, speak very quickly so they do not lose focus. The correct answer is B. Facing the resident directly allows them to read lips and see facial expressions, facilitating clearer communication without shouting. Question 10. When measuring fluid intake, 1 fluid ounce is equivalent to how many milliliters, ml? Choices are 5 milliliters, 15 milliliters, 30 milliliters, 50 milliliters. The correct answer is C. In medical measurements, 1 fluid ounce is standardly accepted as equivalent to 30 milliliters. Question 11. What is the correct sequence for removing personal protective equipment, PP? Choices are gloves, goggles, gown, mask, Mask, gown, goggles, gloves. Gown, mask, gloves, goggles. Goggles, mask, gloves, gown. The correct answer is A. Removing gloves first is critical because they are the most contaminated part of the personal protective equipment. Question 12. What is the primary goal of restorative nursing care? Choices are to do everything for the resident so they do not have to work, to help the resident regain and maintain their highest level of independence, to cure the resident's chronic illnesses, to prepare the resident for transfer to an acute care hospital. The correct answer is B. Restorative care focuses on promoting self-care and helping the resident retain as much functional independence as possible. Question 13. If a resident asks a CNA for their prescription medication, what should the CNA do? Choices are: administer the medication from the resident's bedside drawer. Tell the resident they do not need the medication. Inform the nurse immediately of the resident's request. Ask a family member to give the medication. The correct answer is C. Administering medications is outside the CNA's scope of practice, so the request must be immediately referred to a licensed nurse. Question 14. What is considered a normal respiratory rate for a healthy adult at rest? Choices are 5 to 10 breaths per minute, 12 to 20 breaths per minute, 25 to 30 breaths per minute, 35 to 40 breaths per minute. The correct answer is B. A normal resting respiratory rate for healthy adults typically ranges from 12 to 20 breaths per minute. Question 15. If a CNA suspects that a resident is being abused, what is their immediate responsibility? Choices are: investigate the abuse themselves, ignore it unless they see it happen again, report the suspicion to the charge nurse immediately, confront the suspected abuser directly. The correct answer is C. As mandated reporters, CNAs must immediately report any suspected physical, emotional, or financial abuse to their supervisor. Question 16. When providing foot care to a diabetic resident, what action should the CNA avoid? Choices are: washing the feet with warm water, drying the feet thoroughly, especially between the toes, cutting or trimming the resident's toenails, applying lotion to the tops and bottoms of the feet. The correct answer is C. CNAs must never cut a diabetic resident's toenails due to the high risk of infection, injury, and poor circulation associated with diabetes. Question 17. To lift an object safely using good body mechanics, where should the CNA bend? Choices are: at the waist, keeping the knees straight, at the knees and hips, keeping the back straight, at the neck and upper back, wherever it feels most comfortable. The correct answer is B. Bending at the knees and hips utilizes the strong muscles of the legs rather than the back, reducing the risk of musculoskeletal injury. Question 18. When caring for a resident with Alzheimer's disease who is experiencing sundowning, what should the CNA do? Choices are: keep the environment calm, quiet, and well-lit in the evening. Turn off all lights to encourage immediate sleep. Insist that the resident stay in bed. Introduce a new, complex activity to distract them. The correct answer is A. Maintaining a calm, quiet, and well-lit environment in the evening helps decrease confusion, anxiety, and agitation associated with sundowning. Question 19. What is the primary purpose of providing postmortem care? Choices are: to prepare the body for autopsy, to preserve the body for a long period, to prepare the body for viewing by the family with dignity and respect, to prevent rigor mortis from occurring. The correct answer is C. Postmortem care is performed to ensure the deceased resident's body is clean, properly aligned, and presented respectfully for their loved ones. Question 20. When caring for a resident with an indwelling urinary catheter, where should the drainage bag be secured? Choices are: on the bed frame below the level of the bladder, on the bed rail for easy viewing, At the foot of the bed above bladder level. Held in the resident's lap. The correct answer is A. The urinary drainage bag must be kept below bladder level on a non-moving bed frame to prevent the backflow of urine, which can cause infections.